Now, on the 23rd of July 2020, leadership of the Association of Small Towns Water Supply Systems, Ghana, issued a statement threatening to withdraw their services to supply Ghanaians with free water, as announced by the President. That's live on the Pulse, and the District Director of Health for the KJB District in the Oti Region, Eric Nanatechi, has revealed that the unavailability of funds at the Directorate is impeding the fight against COVID-19 in the district. According to the director, surveillance is becoming a challenge as the Directorate does not have enough funds to support the process. He adds the Directorate would sometimes have to rely on support from members of his staff to send samples collected to testing centers. Peter Senu has more.
Since the advent of COVID-19 into the country some 5 months ago, the District Director of Health for the KJB District, Eric Nanatechi, has received PPE from various institutions with one appeal, asking for more to stem the fight against COVID-19. The appeal this time is for cash and fuel for COVID-19 surveillance after he received some PPE from a philanthropist, Bawa Faisal. According to the health director, it is difficult conducting surveillance due to unavailability of funds.
I can't say Minisalaba alone does not work. You see, the main challenge we have regarding the fight of COVID in the district is mainly funds. We are challenged with disease surveillance. Today, a facility will call you, they are suspecting COVID case. Quickly, you have to move there with your car and petrol. You pick the sample, you have to transport it all the way to home. So before you finish surveillance on just a particular case, about 500 Ghana cedis is gone. Almost every day, receive calls from communities. You have to follow up, pick their samples, take it to home. So in a month, the district spent close to about 7,000 just on surveillance cases, taking the samples, taking to home, doing contact tracing, transporting them to isolating center, managing them, feeding them, about 7,000 goals. But we don't seem to receive much from above. If we are seriously challenged, sometimes individuals have to sacrifice their mega salary just to fight or champion this cause. Maybe can equally mobilize your people to at least contribute your widow's mite in the form of cash or fuel just to support us in surveillance activities that we very much appreciate.
The philanthropist, Bawa Faisal, is appealing to residents to continue to apply strictly the various protocols, especially the wearing of the face mask, adding COVID-19 is real.
Where I work, we are still working from home because we realize that it is real, and people should not think that it is far from them. No. The challenge with COVID is that you may not be able to identify physically somebody who has it, and that is what makes it difficult. So we should continuously use the face masks, wash our hands as often as possible, and then we should be able to physically distance even when we are sitting around in our area, so that at least we minimize the spread within the community.
The recent to join the COVID-19 fight in the district is World Vision International. They have provided a number of semi-automated hand-washing facilities and other PPE to the KJB District Assembly and other decentralized agencies in the district. Salome Yeboah is the Nkwanta Cluster Manager, World Vision International.
As an organization, we have realized that fighting the pandemic, that's COVID-19, it's a shared responsibility. This is something that the government cannot do alone. So as an organization, we deem it proper to actually ensure that we support them with the item, these PPEs, to help them fight the disease or the pandemic.
Peter Senu for JoyNews.